right, Dr. Sandoval. I'm feeling a bit turned around by this one. The problem says the physician reduced the IV to 30 milliliters per hour, and there's 270 milliliters remaining in the bag according to the IVAC. I keep trying to figure out if I should calculate the total time first, or if I need to think about the remaining volume differently because of the reduced rate. Can we walk through it?
I can see why this one feels a bit tricky, Priya. The wording combines a calculation with a timeline, which can make it feel like you need to solve two problems at once. Let's start by breaking down what we know and what we need to find.
Okay, Dr. Sandoval, I see what you mean. We know the IV rate is 30 milliliters hour, and there are 270 milliliters remaining in the bag. We also know it's 10 to 30 a.m. now, and we need to find the completion time. So, I think I need to divide the remaining volume by the rate to find out how long it will take. So 270 milliliters divided by 30 milliliters hour gives me 9 hours. Is that the right first step?
Yes, that's an excellent first step, Priya. You've correctly used the available volume and the reduced infusion rate to calculate the total time the infusion will run. You've identified that 270 milliliters, 30 milliliters hour, equals 9 hours. This means the IV will run for 9 more hours.
Okay, so if it's 10:30 a.m. now, and the infusion will run for 9 more hours, I need to add that to the current time. So 10:30 a.m. plus 9 hours. That would make it 6:30 p.m., right? I'm trying to be careful with the time conversion.
That's exactly right, Priya. 10:30 a.m. plus 9 hours puts the completion time at 6:30 p.m. You've handled that time calculation perfectly, recognizing the shift from AM to PM.
Oh, awesome! I'm so relieved that's correct. I was really getting hung up on how to put the duration and the current time together. Thank you so much for your help, Dr. Sandoval. Hello, Dr. Sandoval. I'm having a bit of trouble with this infusion calculation. It feels like I'm just cycling around trying to figure it out. The problem states the physician reduced the IV to 30 milliliters per hour, and the IVAC indicates 270 milliliters remain in the bag. It asks what time the infusion will be completed if it's exactly 10:30 a.m. now. I keep thinking about one way to get the total time, and then another, and I'm not sure which path to follow.
I can see why this one's making you cycle, Priya. Many students overthink this type of problem, when really, it comes down to applying a fundamental rate relationship. Let's break it down together. We know the IV is running at 30 milliliters per hour, and there are 270 milliliters left. The question asks us to find the completion time starting from 10:30 a.m. What's the very first thing we need to figure out before we can determine the completion time?
I think we need to figure out how long the 270 milliliters will take to infuse. So I would divide 270 milliliters by 30 milliliters per hour, which gives me 9. Does that mean it will take 9 minutes? I always get mixed up with hours and minutes sometimes.
You're absolutely on the right track with dividing the remaining volume by the infusion rate. The calculation, 270 milliliters, 30 milliliters hour, does indeed give you 9. Now let's look closely at your units. You have milliliters divided by milliliters per hour. What happens to the milliliter units in that division, and what unit are you left with?
Oh, I see. The milliliters cancel each other out when you divide, so the unit that's left is hours. So the infusion will take 9 hours, not 9 minutes. That makes more sense.
Excellent, Priya. You've correctly identified that the milliliters cancel out, leaving you with hours. So the infusion will indeed take 9 hours. That's a crucial distinction, and you've handled it perfectly. Now that we know the infusion time, how do we use the current time of 10:30 a.m. to find out when the infusion will be completed?
Okay, so we have 9 hours to add to 10:30 a.m. I would just add the hours. So 10 plus 9 is 19. And then we have the 30 minutes. So 19:30, which would be 7:30 p.m. Is that what I should do?
That's exactly right, Priya. Adding 9 hours to 10:30 a.m. brings you to 19:30 in 24-hour time, which is 7:30 p.m. You've correctly calculated both the duration and the completion time. Congratulations, you've solved the problem. To summarize, We divided the remaining volume by the infusion rate to find the total infusion time, and then added that time to the current time to get the completion time.
Oh, that's great. I'm so relieved to have solved this one, Dr. Sandoval. The unit conversion from milliliters per hour to just hours was definitely where I got stuck, but now I understand it. And then adding the time was straightforward after that. Thanks so much for helping me work through it.